My name is Dr. Jun Tuishime. I'm obstetric anesthesia fellow at the Western University. I'm also the co-founder and CEO of the Initiative for Medical Equity and Global Health in Rwanda. Thank you for the opportunity to present. The title of my talk is The Role of the Obstetric Anesthesiologist in Global Health, the Experience from the World Federation of Society of Anesthesiologists, Rwanda, and Botswana. By the end of this presentation, I hope that everyone will be able to understand how obstetric anesthesia practice is different in rural resource settings, appreciate the role of obstetric anesthesiologists in improving global health equity, and then understand the rationale as well as the benefits of being involved in global health work and the process to follow in order to find global health opportunities. Before we go in details, I would like to give a little bit of the context of where I did most of my work. So Rwanda is located in East Africa. It shares borders in the north with Uganda, the south with Burundi, east side with Tanzania, and the west side of the Democratic Republic of Congo. Rwanda now is known to be a good destination for uh, high-level conferences. This is, you can see the Kigali Convention Center on the right, which has been receiving many international events. If you come to Kigali in Rwanda, you will have opportunities to do a little bit of tourism where you can see the gorillas. And also, if you like sport, you can find nice facilities, including the Kigali Golf Club. Also, Rwanda is now known to be hosting prestigious universities. I was privileged to be part of the University of Global Health Equity, which is ranking among the top 8 universities in Sub-Saharan Africa. Let's go back to our presentation and I will start with the key concepts about global health. So global health is defined as an area for study, research, and practice that places a priority in improving health and achieving health equity for all people worldwide. It may be also seen as a collaborative transnational research and action for promoting health for all. We have also to remember that it has colonial roots. It started as tropical medicine and then international health, where the agenda was set by high-income countries. What is health equity? Health equity is defined as absence of unfair, avoidable, or remediable differences among groups of people, either socially, economically, demographically, or geographically, or by other dimensions. Some of the examples include ethnicity, disability, and sexual orientation. Another key concept is equitable partnership. Uh, so in order to have a equitable partnership, we have to consider some values as proposed by Zaman and the colleagues. So values like fairness, respect, care, and honesty. And as we are proposing solutions, we should think about involving the local partners done throughout the whole processes, including co-creation, and then we ensure communication among teams, commitment for success, and continuous review for improvement. The other way to look at it is to have a mutually beneficial and power-balanced partnerships and processes leading to equitable and human and environmental health outcomes. Actually, there are some tools to use in evaluating equitable partnerships, and one of them is the one on the right side, which has 4 main domains and 31 questions. It focuses on governance or the process, procedures, and operations, the progress or impact, and the power and the inclusion. So if you need details about this tool, you can have it by scanning the QR code. Now that we discussed some key concepts about the definition of global health equity and also equity partnership, let's go in details and talk about the challenges of safe obstetric anesthesia in low and middle income countries. One of the key problems is high maternal mortality in low and middle income countries. As you can see that about 95% of all maternal deaths occur in low and middle income countries. Sub-Saharan Africa has 70% of all those deaths. In Nigeria, which is one country, has about 28% of those uh, cases. And if we look on the maternal mortality rate, if we compare, for example, Rwanda, where I did most of my work, in comparison to Canada, the maternal mortality is 22 times higher. And if you compare also the top three causes of death, we can see that the preventable cause of death are still common in low-income countries. In the example of Rwanda, sepsis, there was one study which showed that sepsis was the number one cause and was affecting about 50% of those deaths. And also in one center, which is a big referral center, it was having about 72 deaths. And this is almost double, more than double all deaths, maternal deaths occurring within Canada. When we look at the obstetric anesthesia deaths, in high-income countries, it's very low. It's around 6.5 per 1 million cases. But if you compare in low-income countries, it is still very high. It's about 200 per 1 million cases, and this is about 30 times higher. So a lot of work is needed and a lot to make progress. The other key issue is shortage of staff. If we look on the figure on the left, we can see that Africa, especially Sub-Saharan Africa in red, has less than one uh, anesthesia provider per 100,000 population. And if we look on the numbers, it is about only 5,000 physician anesthesiologists for the whole continent, while half of them really they are just in one country, South Africa. If we compare to Canada, for example, Canada as a country, during that time in 2015, Canada had about 3,200 physician anesthetists and 660 residents. This is almost half of the anesthesiologists in the whole continent of Africa. Is there any change? Are we making progress in increasing those numbers? Actually, if we look on low-income countries, there is even a decrease in the number of both physicians and non-physician providers. However, low and upper middle income countries, they made good progress, where the upper middle income countries have increased their numbers in the last 7 years of more than 3 providers per 100,000 population. If we look for high-income countries, number of physician anesthesiologists also is decreasing. If we go in details and look for examples in per region and some countries, we can see that Canada is meeting the target of 4 per 100,000 population, like other most high-income countries. If we look for the Southeast Asia region, India, as example, is meeting the target. But if we look in Africa, Rwanda, for example, is still having a very low number of physician anesthesiologists, and it's having a density around 2. Uh, Only a few countries really meet the target sub-Saharan Africa. In some countries like Burundi, they don't even have any physician anesthesiologist. The issue of shortage is not only about anesthesia providers. If we look for the surgical workforce in general, we can see that in low and middle income countries, even if they have 48% of the population, they have only 15% of physician anesthesiologists, 19% of surgeons, and only 29% of obstetricians. And this number has been very low for low-income countries with a density of 0.7 per 100,000. This is very low in comparison to high-income countries with a density of 56.9 per 100,000. Another issue of practicing anesthesia in low-income countries is the lack of adequate infrastructure and equipment. If we look on this study, which was conducted in 7 low middle income countries, we can see that 1/3 of those hospitals were lacking reliable electricity, a quarter of them were lacking reliable oxygen, and half of them were lacking a recovery area, and labor analgesia was not available in most of those places, only 4%. For equipment, if we look on this study as well, looking at availability of some equipment, you can see that some of the centers, like Morago, was not having really EKG monitoring at all. It was less than 10%. And if we look on availability of the difficult airway cut and infusion pump, also it's very low, more than less than 30% for most of these centers. However, the pulse oximetry and suction and the nerve stimulator seem to be available. Um, so another big issue is lack of local standards, which would be essential for safe practice. Uh, so, for example, in Rwanda, it took many years to develop a local uh, standard of practice of anesthesia endorsed by the Ministry of Health. So this is recent. I was lucky to be part of, or to be the co-chair of these standards, and they were endorsed and published in 2022. Lastly, another big issue is lack of adequate funding. Uh, if we look on the map on the left, we can see that most of countries in sub-Saharan Africa, their health spending is less than 118 US dollars. This is very low in comparison to high-income countries like the US, which is spending about 15,000 US dollars per capita. And we can see that the total health spending of 8 trillion, which is about 80% of the global GDP, is spent mostly in high-income countries, about 81%. And if we look, the USA alone is spending 41%. It is interesting to see that low-income countries, even if they have about 10% of the population, their health spending capacity is only 0.4% of the total capacity. And if nothing is done or nothing is changed, it will be the same situation in the next 30 years. As we're talking about health financing, so who are the major players and what are the many areas funded in global health? So if you look on the left, you can see that most of the funding in global health is directed towards HIV, TB, and malaria, which are infectious diseases, and then newborn and child health and the reproductive health, which is maternal and child and newborn health. So these are the main areas of focus. Another area which will be important for anesthesia is the health sector support, but this is not a big priority in global health. And if we're going to make progress, we need to convince the bigger donors. And who are those main donors in global health? So usually it's high-income countries, governments, including usually the US, the UK, Germany, and France, and also big corporations and non-for-profit organization like the Gates Foundation. How much of investment is needed for safe global surgery? If you look on the last column, you can see that in order to achieve the Lancet Commission on Global Surgery target, we are requiring an investment of about globally of 350 billion US dollars by 2030. And this is a big investment of about 23 billion per each year. Even if this is a big investment, there is also high return because there is potential to save about 12 trillion 12 trillion US dollars, which will be lost if there is no investment. And this will also provide safe surgery to about 148 million more people each year. This is a huge impact, but this is also require a big investment, which has never been done before. But we have few examples where also big investment have been done, but not at the same scale. One of the examples, the investment around HIV treatment, which has raised billions and billions of dollars, about 80 billions of dollars in 15 years, for example, and impacting about 14 million people. So how are we going to measure progress if we convince some donors? So there are the Lancet Commission indicators, including uh, access to 2 hours, access to surgical care, number of surgical anesthesia and obstetric providers of 20, having 5,000 procedures per 100,000 population, ensuring tracking the preoperative mortality rate, and also protecting the population against impoverishment and catastrophic expenditure while receiving the surgical care. Those are the sum of indicators which will show that progress has been made. Just to summarize the key challenges in practicing in obstetric anesthesia in middle-income countries, Uh, there is still poor maternal outcomes, mainly due to severe shortage of staff, inadequate infrastructure and equipment, and lack of local standards of anesthesia practice, and inadequate health funding. Now that we have discussed these challenges, so what is the role of the anesthesiologist in global health? Let's start by asking ourselves why anesthesiology should be involved. In my view, you will be involved in global health if you are committed to advocacy for access to healthcare for the most vulnerable people globally. Another reason may be a commitment for health equity. And lastly, believing that health is human right. And I want to use the quote from late Paul Farmer, who was the founder of the University of Global Health Equity, and one of my professors, who said that, quote, if access to healthcare is considered human right, who is considered human enough to have that right? And when I saw this quote, it made me thinking about global health. So the other way to think about global health is to look on what the US government uh, suggests as the reason they are involved. They say that the reason they're involved in global health is to secure protection against global health threats and also to promote productivity and economic growth in other countries. Even in Canada, there is now recognition of the role of global health. As you can see, this paper and authors say that, I quote, we call for the urgent incorporation of basic global health education into all North America anesthesia training programs, the expansion of the structured global opportunities for residents and fellows seeking a career path focused on health disparities locally and or globally, and the establishment of anesthesia-specific global health competencies and curricula. This can serve as steps towards improving access to safe anesthesia, analgesia, and surgical services for vulnerable and marginalized populations in all countries. Only through a more rigorous and structured approach to global health than training can we hope to develop globally conscious anesthesiologists that are equipped to effectively advocate for underserved populations and play a more central role in shaping the creation of future health systems. Yeah, with this is, I think this is also a good way to show that global health is important in our context. What are some benefits to be involved in global health? So at the individual level, you may have a more sense of fulfillment and social impact. You may be involved with research and innovation, leading to chances for academic promotion. You may have more opportunities for professional growth with more cross-cultural communication. For example, once you're involved, having better use of resources, um, some networking and collaboration opportunities, and you may have more tools and motivation for advocacy for marginalized group once at home. At institutional level, again, this is a good chance to fulfill the institutional mission and values, especially if the health equity is part of the mission, and enhance research opportunities where more funds can be raised and more collaboration and innovation opportunities as well. There's a chance for cross-cultural learning and collaboration, where the trainees will have a more exposure, and you have a chance for global impact in the reputation, and you have also potentially a positive impact on local communities, especially the vulnerable population. Lastly, there is a contribution to global health security. However, there are some challenges to consider, and at individual level, there are personal safety risks, especially on site, and there are cultural and ethical issues in terms of the type of care provided in the context of lack of resources, and those lack of resources also may be challenging. Um, that may lead also to burnout and decreased job satisfaction. You may face also language barrier. At institutional level, some barriers including different priorities and expectations with collaborators, some cultural and ethical considerations, especially around power dynamics and decision making, uh, uh, and you may have as institution face challenges with insufficient funding, um, and you may have a poor performance of staff uh, coming from global health assignment, especially if they have low job satisfaction or burnout, or they get some other opportunities or commitment to be involved in leadership and research. Um, you may have uh, issues around sustainability and local capacity building as part of your program. Lastly, for both at individual level and institutional level, this global health activities may cause logistical and administrative burden, especially around visa application and ethics approval. So what are the kind of activities will you be doing if you are involved in global health? So you may do direct clinical care, teaching, research and quality improvement, and advocacy. Mainly those are the activities. You may also be involved in mentorship, grant writing, and leadership. There's this book about the role of the anesthesiologist in global health that I would recommend, and you can scan the QR code to have access. It has good examples of experts uh, from around the world uh, sharing their experience. Now that you now that you have a picture of the reason why you should be involved in a global health, how a day would look like, assuming that you are like supervising a student in a different country. So let's look on the right side to see a day for a senior resident in the context of Ghana. This was a fictional example. Um, as you can see, I will let you read around this a little bit, and I will make a small comment. I will give you 30 seconds to read this. I want to highlight few things is that at the same day, a senior resident may be involved in covering different subspecialties, including pediatric cases, emergency or urgent cases, ICU, and being called at the emergency on the ward as well, and usually without direct supervision. And this is maybe challenging in learning environment and maybe also stressful. Um, uh, yeah, I wanted just to share how the training may be different, but also the practice because of the shortage of anesthesiologists. Now I would like to share my experience in global health uh, in Rwanda. So um, I have been part of the team which co-founded a non-for-profit teaching organization where we have managed to support uh, smaller hospitals by providing regular training. So we provided different courses, including BLS, ACLS, PARS, safe obstetrics, uh, and VAST, which is vital anesthesia simulation training, to a total of more than 1,000 people in the last 5 years. And we conducted 31 sessions, different courses. And the main reason we did this was we wanted to improve early recognition of complication and also early referral of patient to us when we're based on teaching hospitals. And was successful, and our work has been recognized by the World Federation of Society of Anesthesiologists. The other activity that I have been doing was advocacy and research. One of the examples of advocacy is one of our recent papers uh, in the American Society of Anesthesiologists journal, where we were advocating around the anesthesiologist training in low and middle income countries, proposing potential solutions for the challenges they face. There's also an example for a recent research project published in the resuscitation channel, uh, where we're combining team training to the regular resuscitation training to in the context or on long-term context. I have also been involved with some leadership opportunities and the quality improvement project. So one of the examples is the development of the standards of safe practice of anesthesia in Rwanda, which was the first edition, and I was lucky that I was a co-chair of these um, guidelines, and I conducted different quality improvement projects. One of them was the implementation of early obstetric warning signs in district hospitals. Um, Another activity that I was involved in was recruitment of resident into the anesthesia program. And as you can see on the right side, uh, there has been a challenge of having enough resident coming to the program, especially for the reasons on the left, including long work hours, high stress levels, insufficient mentorship, and few job opportunities. Uh, and with like some strategies for recruitment, we managed to have more people in the program, and now the physician and anesthesiologist number has increased from 19 in 2018 to 58. This is 3 times increase in just 6 years. And the program has now about 30 residents in the program, and there's a new program starting this year with the potential to have 15 more residents each year. I was also involved in Botswana where I supported their program by designing the teaching plan for first-year resident and being involved in teaching first-year and second-year resident. I was also involved with research supervision and providing different courses to both physician and non-physician anesthetists. At the same time, we managed to get one paper published about advocacy around the situation of regional anesthesia practice in public hospitals in Botswana, and we won a small grant to implement the obstetric anesthesia course, especially for non-physician anesthetists in Botswana. Another activity that I was involved in global health was through the World Federation of Society of Anesthesiologists. First, I was involved with conducting different courses, including SAFE, Advanced, and Inspire course. Second, I was invited to present in different conferences, both in 2021 and 2023. And third, I was lucky to be part of the WFSA committees, both Workforce and Wellbeing Committee. And I hope that we'll publish some papers around workforce well-being in around August this year. And I was involved. I'm part of the education committee as well, and I will be part of the faculty in the next WFSA conference in 2026 in Morocco. On the right, also, there's a picture where the work we have done in Rwanda has been recognized by the Rising Star Award, which was received recently in Singapore. So in summary, the main reason to be involved in the global health, you may be committed for advocacy, for better care for the most vulnerable population, commitment to health equity, and also believing that health is a human right. There are some personal benefits, including having a sense of fulfillment and a social impact, having research and innovation opportunities, professional growth, and network and collaboration. And the role that you are expected to be doing include both clinical teaching and research and advocacy. What are the some of the global health opportunities? So I have multiple examples, and I provide also the links to those organizations. But today I will just focus on the CASIF, which is the Canadian Anesthesiologist Society International Education Foundation, which is supporting these residency programs in multiple countries. And also the Initiative for Medical Equity and Global Health. It's our organization I co-founded, and we provide mainly educational opportunities and quality improvement programs in Rwanda. We hope to also be involved by working with the Botswana government and also Ghana. What are the processes to follow? So for CASIF, for example, it's the regular requirements. You have to have independent practice license in Canada, and also if you have prior teaching experience in the global health work, that will be more helpful as well. And you have to show that you have commitment to global health, and also you understand the challenges of practicing in low and middle income countries. Once they have reviewed your application. Uh, Once you have sent your CV, uh, then you will have to send your CV and then submit an application, and then there will be a selection process, and then an interview, and then notification of the decision, um, and then uh, there will be a preparation and the training for the assignment. And usually the deployment is about 4 to 6 weeks, and there will be a debriefing at the end. So another point I want to make as we prepare these global health opportunities is to start thinking about investment in a global health rather than just providing aid. And I have few examples to show about the Rwandan government, how they are investing in global health. And one of the project is the one uh, one called 4x4 reform, where the Rwandan government and its partners they are investing 350 million US dollars with the aim to increase the number of healthcare providers by 32,000 in the next 4 to 8 years. They will also have better infrastructure and equipment, and with the goal to have world-class health services um, in mainly the teaching hospitals. Another example is the BioNTech Rwanda, which is a partnership with the BioNTech company from Germany, which is going to invest about 150 million US dollars to to have mRNA vaccine manufacturing plant, and they will have also local capacity building, and they will be producing vaccines and some drugs for the African market. Another example is IRCAD Rwanda, which has invested 35 million US dollars to have a minimally invasive surgery training center in Rwanda, which was a partnership with the French government. And this will help to train surgeons from across sub-Saharan Africa. So again, the key consideration as you are looking for the global health opportunity is to think about your area of focus, the area of focus of the organization and your own expertise, the expected roles and activities, the location, and the duration of assignment, and if possible, uh, be in touch with someone who had experience working with that organization before. Um, Also, you have to think about the personal goals, as we have discussed before. Uh, are you going to, what is your main reason you're joining the organization? This will guide you to decide which organization to support. So during my experience in global health, there are a few lessons that I have learned, and I learned that I think formal global health training is helpful for a successful global health career. Reliable teams and equitable partnerships led to successful global health project. Resilience and patience are essential while waiting for impact, and local ownership is essential for sustainability. Thank you very much for your kind attention. If there are any questions, you can ask questions now, or you can send questions to my email, or you can also scan this QR code, and you have access to our website where you can contact us with any question. Thank you very much.